The job description of a clinical assistant centers on providing essential support to healthcare professionals and patients in clinical settings, such as hospitals, private practices, outpatient clinics, and long-term care facilities. These professionals play a vital role in ensuring smooth and efficient operations in a healthcare environment by combining administrative duties with basic clinical tasks. Clinical assistants act as a bridge between patients and medical staff, facilitating communication, maintaining records, and ensuring that patient care proceeds without delays. With healthcare becoming increasingly patient-focused and streamlined, clinical assistants have become indispensable. Their work supports physicians, nurses, and medical technologists, allowing these professionals to focus more on diagnosis and treatment. Whether scheduling appointments, taking vital signs, or assisting during medical procedures, clinical assistants must maintain a balance of compassion, precision, and efficiency. While the specific duties of clinical assistants may vary based on the workplace and scope of practice, the underlying goal remains the same: to provide quality support that enhances patient care and operational efficiency. Most clinical assistants work full-time and may have to work evening, weekend, or holiday shifts depending on the healthcare setting. Primary responsibilities of a clinical assistant. The first responsibility of a clinical assistant is to provide direct support to medical staff. This includes preparing examination rooms, ensuring that medical instruments are sterilized, and restocking supplies. Before a physician sees a patient, the clinical assistant may collect preliminary information such as height, weight, temperature, and blood pressure. Patient interaction is a major aspect of the role. Clinical assistants greet patients, confirm personal and insurance details, and explain upcoming procedures or tests. Their interpersonal skills play a key role in reducing patient anxiety and ensuring that each individual feels heard and cared for. Clinical documentation is another important responsibility. Clinical assistants update medical records with patient histories, medication lists, and any clinical observations. In many cases, they enter this information into electronic health records, EHR systems, requiring familiarity with healthcare software. In terms of administrative work, clinical assistants schedule appointments, manage billing or insurance forms, and handle phone calls. They serve as a communication hub between patients and healthcare providers, relaying messages, responding to inquiries, and coordinating follow-up care. Their multitasking ability is critical in busy clinical settings. Assisting during medical procedures is also common. Clinical assistants may help physicians during physical examinations or minor surgeries by passing instruments, holding patients in proper positions, or applying dressings. They must be knowledgeable about basic medical protocols and hygiene standards to prevent infections and ensure safety. In some settings, clinical assistants may collect lab specimens, perform basic laboratory tests, or conduct EKGs. They might also be responsible for preparing patients for X-rays or other diagnostic procedures. The range of tasks they perform often depends on state regulations and the supervising physician's delegation. One crucial aspect of the job is maintaining patient confidentiality. Clinical assistants must follow HIPAA regulations and organizational policies to safeguard sensitive medical information. They must also demonstrate professionalism and discretion in all interactions. Essential skills and qualities for the role. To thrive as a clinical assistant, one must possess a blend of clinical knowledge, administrative competence, and interpersonal finesse. First and foremost, excellent communication skills are essential. Clinical assistants must be able to convey information clearly to both patients and healthcare providers. They must also be good listeners to accurately document patient concerns and relay information effectively. Attention to detail is another core skill. From recording medical information to managing appointment schedules, precision is vital. A small oversight can have significant consequences in a medical setting, so accuracy is non-negotiable. Empathy and compassion are critical qualities. Clinical assistants often deal with patients who are in pain, stressed, or frightened. A kind demeanor and reassuring presence can make a world of difference in patient experience. Understanding cultural differences and exhibiting sensitivity is equally important in diverse communities. Technical skills also play a significant role. Clinical assistants should be comfortable using computers, healthcare software, and medical equipment. They should understand how to operate blood pressure monitors, thermometers, and EHR systems. In addition, basic knowledge of medical terminology, anatomy, and pharmacology is essential. Multitasking and time management are everyday necessities. Clinical assistants often juggle multiple duties simultaneously, answering phones, assisting with patient exams, entering data, and more. The ability to prioritize tasks and remain organized under pressure is vital for efficiency and job satisfaction. Problem-solving skills are needed to address scheduling conflicts, handle difficult patients, or respond to unexpected changes in a physician's availability. Clinical assistants must remain calm, think on their feet, and find solutions while maintaining professionalism. Work environment and challenges. Clinical assistants work in fast-paced environments that demand flexibility and resilience. Their settings range from general practices and specialty clinics to emergency departments and outpatient care centers. The work environment is typically clean and well-lit, but it can also be stressful, especially during peak patient hours. One of the main challenges is handling a high volume of patients. This requires efficiency without compromising the quality of care. Clinical assistants must stay alert and responsive to ensure that every patient receives timely attention. The physical demands of the job can also be challenging. Standing for long periods, lifting or repositioning patients, and moving between examination rooms are all part of the daily routine. Good physical stamina and body mechanics are necessary to prevent fatigue or injury. Dealing with difficult or anxious patients is another hurdle. Clinical assistants must be skilled in de-escalation and remain calm under pressure. They must know how to address concerns without breaching medical protocols or undermining the physician's authority. Technology and documentation requirements can add to the workload. Keeping up with software updates, learning new systems, and meeting documentation deadlines require dedication and adaptability. Despite the challenges, many clinical assistants find their work deeply fulfilling. They are part of a healthcare team that makes a real difference in people's lives. They witness patient recoveries, provide emotional support, and contribute to the overall wellness of the community. Educational requirements and training. Most clinical assistant roles require a high school diploma or GED as a minimum qualification. However, employers often prefer candidates who have completed a post-secondary certificate or diploma program in medical assisting or a related field. These programs usually include coursework in medical terminology, anatomy, basic clinical procedures, and medical office administration. In many cases, clinical assistants receive on-the-job training. However, formal education can provide a competitive edge and open the door to higher responsibilities. Certification is not always required, but it is highly recommended. Recognized certifications include the Certified Clinical Medical Assistant, CCMA, from the National Health Career Association, NHA, and the Registered Medical Assistant, RMA designation from American Medical Technologists. Training also includes hands-on clinical experience through externships or internships. These placements allow aspiring clinical assistants to practice skills in real-world settings under supervision. They also provide networking opportunities and enhance employability. Continuing education is important for maintaining certification and staying current with medical practices. Many employers support professional development through workshops, online courses, or tuition reimbursement. Career advancement opportunities. The job description of a clinical assistant is often a stepping stone to higher roles in healthcare. With additional education and experience, clinical assistants can become licensed practical nurses, LPNs, registered nurses, RNs, medical office managers, or physician assistants, PAs. Specialization is another option. Clinical assistants can focus on specific areas like pediatrics, cardiology, dermatology, or ophthalmology. Specializing allows for deeper knowledge, better job prospects, and potentially higher salaries. Leadership roles are also attainable. Experienced clinical assistants may take on supervisory positions where they manage junior staff, oversee schedules, and coordinate daily clinic operations. Some may transition into roles in medical billing, health administration, or patient advocacy. Conclusion. The job description of a clinical assistant highlights a multifaceted role that combines patient care with administrative precision. These professionals are essential in ensuring that healthcare facilities run smoothly and that patients receive compassionate and competent care. For individuals interested in the medical field but not ready to pursue long-term schooling, becoming a clinical assistant offers a practical and rewarding career path. With the right skills, training, and attitude, clinical assistants make a meaningful difference in the lives of patients and the effectiveness of medical teams.